If you've ever had a bad sore throat and had the pleasure of standing in front of the bathroom mirror only to notice some nasty white stuff at the back of your mouth, then you probably had something colloquially known as strep throat. In addition, you almost certainly didn't have very nice breath to go along with that painful sore throat. I'm not sure which is worse, the terrible pain in your throat or the embarrassment of the bad breath associated with it. In any case, this lesson will cover the cause of both of these issues and more associated with strep throat. The more technical term for strep throat is actually streptococcal pharyngitis. The pharyngitis in streptococcal pharyngitis refers to the inflammation itis of the pharynx. Basically, part of the pharynx is the back of the throat you see when you say ah in front of the mirror. In any case, the pharynx becomes inflamed because certain bacteria called streptococcal bacteria are spread about in airborne droplets during a cough or sneeze. When a person breathes these bacteria in, especially if their immune system is already compromised as it is fighting off a viral infection such as the flu, they may develop strep throat. The main bacterium that causes strep throat is known as Streptococcus pyogenes. This bacterium is known as a gram-positive group A beta-hemolytic streptococcus. The fact that this is a gram-positive bacterium means it has a very thick cell wall compared to a gram-negative bacterium. Since this bacterium is known as a coccus, that automatically means it has a round shape as opposed to a rod-shaped bacteria. Furthermore, streptococcal bacteria form chains of bacteria, as opposed to staphylococcal bacteria, which are also round-shaped bacteria, but do not form the characteristic chains of streptococci. The way I recall that streptococci are formed into chains, especially in the context of this lesson, is by realizing that many people wear chains around their neck. Well, the neck includes the throat, which is where strep throat occurs. Finally, Streptococcus pyogenes is known as beta-hemolytic because it causes complete hemolysis, or the complete destruction of red blood cells when grown on a special plate containing red blood cells. This hemolysis occurs because these bacteria release a toxin that causes the red blood cells to burst open, like a balloon would burst open when pricked by a needle. Beta hemolysis is in contrast to alpha hemolysis, which results in incomplete destruction of red blood cells, or incomplete hemolysis by other types of streptococcal bacteria. Okay, with that massive amount of science mumbo-jumbo out of the way, we can focus on the more relatable aspects of what almost everyone has experienced when they had strep throat. Besides getting a fever, chills, and a throat that really hurts, people can develop some pretty nasty looking white stuff at the very back of the throat where the bacteria have settled in. This white stuff also smells pretty bad, giving you halitosis or bad breath. That white stuff actually has a name. It's pus, which is the same yellowy white thing that comes out of your zits or from an infected wound. Pus is essentially a mixture of dead and decaying bacteria, in this case Streptococcus pyogenes, and the white blood cells that try and kill it, namely neutrophils. You can think of the neutrophils in bacteria as two warring peoples fighting on a battlefield. They try and kill each other on the battlefield, the back of your throat, to gain the upper hand. Sad to say, but dead and decaying people smell extremely bad. It's no different in the case of this infection, where dead and dying white blood cells and bacteria end up smelling pretty bad as well. This battle also creates a lot of inflammation in the back of your throat, which is what causes you a lot of the pain associated with the strep throat. Nevertheless, strep throat can be treated pretty easily. First, it would have to be positively diagnosed by swabbing the back of your throat to look for these bacteria. After a positive diagnosis, your doctor will give you antibiotics, or drugs that kill bacteria, to help your white blood cells fight off the infection even faster. In addition, other drugs such as acetaminophen may be given for some moderate pain relief, since a strep throat, as you surely know, is very unpleasant. As a review, recall that the more technical term for strep throat is actually streptococcal pharyngitis. The pharyngitis in streptococcal pharyngitis refers to the inflammation, itis, of the pharynx. The main bacterium that causes strep throat is known as Streptococcus pyogenes. This bacterium is known as a gram-positive group A beta-hemolytic streptococcus. The beta hemolysis implies this bacterium releases substances that result in the complete destruction of red blood cells when this bacterium is grown on a special plate filled with red blood cells. Besides destroying red-colored things, this bacterium causes other colors, namely white, to accumulate at the back of your throat. This white stuff, pus, also smells pretty bad, giving you halitosis, or bad breath.